Hi everyone, and welcome to my module on the worst girl gang ever trying to conceive after loss course. So this module is going to be all about where to turn next after a miscarriage. So my name is Rachel and I'm a fertility acupuncturist. I had my own fertility journey and my son was born after multiple losses and 3 rounds of IVF. So I also run an online fertility advice service called the Fertility Method, and we offer online fertility consultations where we delve deep into your medical and fertility history, and we then give independent advice on where to turn next. So this might look like a referral for more in-depth testing. It could mean some lifestyle advice or guidance or just general support. However, our main aim is to help you get a diagnosis and the correct treatment in order to achieve a happy, healthy pregnancy. And we're used to seeing couples with complex cases, and there's nothing that we haven't seen before. So, like I said, we're going to be talking all about where to turn next after a miscarriage. So, are you being told, just try again? Are you being told it's just bad luck, or we don't know what's wrong? So how crazy is it that in this day and age, with all the advancements in medical science, that couples are still being told this? There is always a reason for why you might be having recurrent miscarriages, or why you're struggling to conceive, or while you're having unsuccessful IVF treatment. Quite often it's just that not enough in-depth testing has happened, or an area may have been completely ignored. So sometimes this happens due to constraints around resources within the NHS, and sometimes this happens because a fertility clinic will normally want to sell you IVF without a diagnosis. So again, it's completely crazy that we're giving people treatment for something without a diagnosis. Unexplained infertility or miscarriage is not a diagnosis. Saying it's unexplained is just an excuse. So let's talk about some of the reasons why miscarriage happens, and then things you can do to help get to the bottom of why. And also, I'll be referring you to downloadable PDFs that I've created that will give you further information about how to investigate the things I'm talking about. So don't worry about furiously writing notes throughout this video. Everything is backed up in the downloadable content. So first of all, we're going to talk about egg quality. So this is the only unmeasurable. There is no test to determine egg quality. So if you have undergone IVF, then the embryologist might be able to try and give you some idea as to the quality of your eggs retrieved. But other than that, there's no way of knowing whether egg quality is an issue. So all we can do is optimize this with supplements and lifestyle. So there are certain conditions where egg quality can be compromised, and this is with things such as polycystic ovary syndrome or endometriosis, and we're going to talk more about those shortly. However, both of these conditions are hormonally driven conditions, which mean the hormone balance will be impacting your egg quality. So the best way to check your hormones are balanced is with a hormone blood test. So you can use the checklist I've provided, which should give you all the information you need to go and get your hormones checked. But essentially, the balance of your hormones can provide information as to how likely an egg quality issue is for you. So I'd also really recommend reading a book called It Starts with the Egg by Rebecca Fett. It's packed full of evidence-based information about how you can improve your egg quality. You shouldn't let any fertility doctor tell you there's nothing you can do about egg quality. That's not true. There are lots of supplements such as things called DHEA or coenzyme Q10. These can really help optimize your egg quality, and the evidence is there. The evidence is there that shows that these things can improve your egg quality. So like I said, just to recap, we can't measure egg quality, but we can do everything we can to optimize it. And if you're doing everything you can to optimize it, especially if you've got those conditions I mentioned, which we'll talk about more shortly, but then you're covering that base, you're doing everything you can to help improve your egg quality. And in my experience, quite often, miscarriage and unsuccessful IVF is not down to poor egg quality. Maybe in women who are over 40, I see that more often, but clinically there's more often than not other things going on. So the next thing I'm going to talk about is sperm quality. So recent evidence shows us now that sperm quality plays a much bigger part in miscarriage and unexplained infertility than we ever previously thought. The evidence is huge. So just because an egg has been fertilized, it doesn't mean that the sperm has done its job. You know, underlying issues with sperm quality have been shown to have a big impact on recurrent miscarriage and implantation failure. So how do you know whether this is an issue or whether this could be an issue for you? So if you've had IVF, then what happens after day 3 in the laboratory can give you a really big clue as to the underlying quality of the sperm. Otherwise, having a basic sperm analysis can help point us in the direction of any potential issues, and motility can be the biggest indicator of a potential issue with sperm DNA fragmentation or sperm damage. So if you have poor motility, and this is essentially to do with how well the sperm swims, but if you have poor motility, then that points to more underlying issues with the sperm quality. The World Health Organization have just advised that a sperm DNA fragmentation test should be included as part of a basic fertility markup. So therefore, I'd recommend that anyone struggling to conceive or maintain a pregnancy should consider having a DNA fragmentation test. So it's completely possible to have a normal standard sperm analysis, so everything looks normal on the face of things, and still have high levels of sperm DNA fragmentation. So it shouldn't be excluded just because the sperm looks normal on the face of things. And that's the thing with DNA fragmentation. It's not obvious, it's hidden damage. And that can come from either a structural issue, such as a varicocele, or outside factors such as infection or lifestyle or medications. So I would always recommend a referral to a urologist. And again, I've popped the information on the resources page. There's a really good urologist that I've mentioned on the resource page there. So now we're going to move on and talk about some conditions that are often, in my experience, under or misdiagnosed, and these can definitely cause problems, either trying to conceive or with recurrent loss. So endometriosis is clinically the one I see most often, and this affects 1 in 10 women of childbearing age. So it's much more common than you think, and often presents with no symptoms or very mild symptoms, such as, and these are just a few of the symptoms, lower back and leg pain, some pain on having sex or on emptying your bowels, heavier periods, and often women, let's face it, are just told, oh, that's normal, a heavier period is normal. And you might have heavier periods for your whole life, and you've only got your own periods to compare it to, so you think that's normal. You know, and that's repeatedly what we're told. That's the message from external sources. So quite often women that have endometriosis just don't know that they've got it. So I always advise my clients to listen to their gut. So the majority of my patients who later go on to be diagnosed with endometriosis often say that they knew something wasn't right, that their menstrual cycle was just too heavy or painful to be considered normal, but that, you know, the outside influences were just too strong, and they never chase that up. So trust your gut is what I would say. And again, on the resources, there's a section about endometriosis and some more symptoms on there, so you can have a little read and see whether you think that might be an issue for you. Another condition which is often undiagnosed is polycystic ovary syndrome. So there's actually 4 types of polycystic ovarian syndrome, and they all present slightly differently. So you can have the hormonal profile that accompanies polycystic ovary syndrome without having any actual cysts on your ovaries, but your egg quality can still be really compromised. So again, going back to that full hormonal profile, your blood test, this can lay bare so much about what is going on behind the scenes. And sometimes GPs are reluctant to test a full range of hormones. And quite often fertility clinics tend to only look at the relevant ones for fertility treatment, such as follicle stimulating or AMH. So therefore, it's really important that, again, if you feel like there's something else going on, or you know, you think you might have polycystic ovaries or endometriosis, that you make sure these things are properly investigated before you exclude them as a potential option. So have a look at the downloadable PDFs. There's lots more information on there to help you get a diagnosis for something that might be undiagnosed. Another thing I see often in clinic, and something which explains lots of cases of unexplained infertility, is also something called reproductive immunology. And this is actually what happened to me on my fertility journey. So it's often referred to as having highly activated NK cells. So if you have never had a positive pregnancy test naturally, or you've had repeated early losses, or unsuccessful IVF attempts, when you're getting good quality blastocysts and implantations just not happening, then I would definitely be looking at the possibility of your immune system being involved. So an overactive immune system stops the body from allowing an embryo to either implant or from progressing into that second trimester of pregnancy. So it can be triggered by pregnancy, so it shouldn't be ruled out in secondary infertility. So in fact, a lot of my clients that we have diagnosed with high levels of natural killer cells are secondary infertility patients. So I'm not going to talk in depth about NK cells as it's a really in-depth topic, and I could talk for an hour about NK cells. However, if you want to learn more, then I have linked a webinar that I did with Laura of the Worst Girl Gang, and it's in the resources section. And in the webinar, I give a checklist for determining whether NK cells are likely an issue for you. So you can actually do a little bit of self-diagnosis. You can go through the checklist and see whether that's a likelihood for you. So I'd also really recommend a book called Is Your Body Baby Friendly by Alan Beer. And Alan's book is all about reproductive immunology, and it's really enlightening. It can be quite heavy going. It's not an easy book to read, but if you think this is an issue for you, then I would definitely recommend that you have a read. And then there's lots of other conditions. Again, we'll talk a little bit more about them in the resources, but you've got things like blood clotting disorders, such as factor V Leiden, or undiagnosed thyroid conditions, such as Hashimoto's. You can have other uterine issues on top of endometriosis, things such as adenomyosis or Asherman syndrome. So these are all much less common, but they're definitely all examples of other things that can cause recurrent loss or unexplained infertility or unsuccessful IVF. So they're not routinely tested for. And again, I've put some information in the resources about how to go about getting these tested for. But they're definitely things to consider if you're in this situation. So at the Fertility Method, we work to help you get a diagnosis. So we can advise on what might be causing your miscarriage or fertility problems, and we help you to get that important diagnosis before you try again or before you embark on any costly fertility treatment. So this looks like an initial 90-minute online consult, and then in that consult, we're going to go really in depth into your fertility history and general health. And we then create an action plan for you to move forward. And this action plan is really based around your unique clinical picture. So we refer you for further testing for any conditions that it's likely you might have, and we leave no stone unturned. But equally, at the same time, we're not going to send you for any tests where we don't believe this plays a part in your fertility issue. We follow up after any referrals to explain to you the test results and any next steps. And on top of all this, we give you advice on nutrition, supplements, and lifestyle. So if you think you would like us to help you, then you can book an online consultation. And again, the link is in the downloadable PDF. So I really do believe there's no such thing as unexplained miscarriage or unexplained infertility. It just takes time, effort, and often some extra finances, but it's possible to get to the bottom of things. And this is what we do. This is what we're really passionate about. I was on that journey myself, and I only got my diagnosis at the beginning of my third round of IVF. So I had 2 rounds of IVF with no diagnosis, which is completely crazy. So, you know, I look back and I think if I'd had that diagnosis before I'd got into those rounds of IVF, or even, you know, after my initial losses, it would have been really nice to get that diagnosis and be able to go into a future pregnancy feeling confident that what had caused any of the issues beforehand had been addressed, diagnosed, treated, and and addressed, and feeling confident that the same thing was not going to happen again. So thank you so much for listening. So don't forget to follow us on Instagram at The Fertility Method, and if you have any questions, you can drop us a DM as well. And we hope you find this module really helpful, and we wish you all the very best on your journey. Thanks for listening.